we just talked about your big day, and that's just a repeat of so many others that you've done like that.
Yeah.
Got into Google reviews, and that's a big deal. Now, I know it's a big deal because I'm the marketing guy.
Very big deal.
But tell me a little bit about what you guys do to bring that about. How do you get such great reviews? How many? How do you ask for it?
The best way to ask a patient for a review is in the chair. And the way we do that is we have these quick sheets that we drill with the team at morning meetings. Let me see if I can sneak in here. So we have these quick sheets, which have a QR code that go directly to our Google. So you scan it, immediately it pulls up, the star. And then it also says on here in big letters, do you want a chance to win free prizes? Our patients love free prizes. So they get entered into a drawing. This is like the number one way that we get reviews. Our girls in the office or in the operatories are really good about it, but our front team, they're amazing at it, and they make it a competition. They have these cool things at their desk that are like, I don't know if they're magnetized, but you just like tap your phone near it and it just pops up like, click this link and they can leave a review. You give them a target and those two up front will crush it.
Beautiful. Okay, good. So that's NFC technology. That's where it's near field and you just tap. It's like tap to pay.
Yeah. That makes more sense.
Yeah, good. So sometimes in the op.
Yeah, in the op. And then sometimes up front. Another way is our team is required to send follow-up emails. Okay. Every single day you're sending at least however many patients you saw the day before. So if you saw 10 patients the day before, I expect to see 10 follow-up emails on your schedule or on your check sheet. And we don't always send the Google review link if we've seen that they've already done one, or if we, know that they're not the best fit for the practice. Okay. We're not going to send them the Google review link. Not going to open up to that. But emails, and then also we send text messages. When a patient leaves the practice, our messaging system, which is Weave, it has a button that you can just hit and it sends them a review text automatically.
Great. Any other tips that you can help others out with how you guys accumulate this? So you get your team involved, get the patients involved. You have prizes for the patients. What kind of prizes?
So we did around Christmas, we gave out like a $150 gift basket, had like wine and like snacks and like all that stuff. We've done free toothbrushes. We've done free whitening treatment, which I mean is like almost $400 value.
And so it's a lucky draw or is it a drawing?
Yeah. So our receptionist is in charge of keeping track of that. So she has a spreadsheet. Every patient has a number, and then we just use a random number generator, and that's how you get entered. So cool. Yeah.
How about for the team? Tell me a little bit about what you do for the team to get the team so motivated.
Well, our team gets super motivated by incentive prizes. One thing that we do is we'll say, okay, 10 reviews today, we'll buy you lunch or we'll buy you Starbucks. And our patients also love to make Dr. Rich spend money. So if you say, if we get 10 reviews, Dr. Rich has to buy us lunch, they'll be like, yeah, make sure it's somewhere expensive. Go across the street, get hibachi. Like they want to make Dr. Rich spend money. They think it's funny. We have a couple different things where if you get like 3 reviews in one day, you get to pick an incentive prize, which I mean, we range them in value, but the girls have gotten like blenders. Our girls go crazy for kitchen gadgets. So you have to cater to who
your public. Yeah.
Yeah. I mean, we've done waffle makers, smoothie blenders, literally all different things. And then we're rolling out a poker chip system. So we have a bag full of poker chips that have different dollar amounts. So if they get 3 reviews in one day, they'll get to pick one. And there's like $100 chips in there. There's 50. So they can make some money off of it.
That's great. How do you get them so that they competently and comfortably feel like approaching a patient? Then second part of that, can you show me as if I was a patient? Yeah. So we drill it with them, especially like when we rolled out that new sheet, we did a drill in the morning meeting where we had Dr. Rich pretend to be the patient, then have the girls ask for reviews. So I can show you. If you were a patient, we would come in here. So you'd be sitting and then I would just say, so Dan, we've completed your treatment for today. Can you tell me how was your experience? It's great. You guys are phenomenal. I mean, it's obviously a beautiful practice, but kind of more so is just very personal, really like the doctor. Oh, good. Yeah, that's awesome. I really appreciate you sharing that with me. Yeah. One thing that's awesome about what you said was, about the doctors and how you felt like it was comfortable. We have so many people in our community that are looking for a new dentist, and, it's not an easy thing to establish at a new Wasn't
practice.
For me.
Yeah. So having people like you that are willing to share that experience is so valuable. So would you mind leaving us a review on Google?
I mean, I'd love to. I mean, I do have to get back to work. I'm a little bit tight on time, but.
No, I totally understand. It takes less than a minute. I can show you how. Do you have a smartphone?
Yeah.
I mean, who doesn't nowadays, right?
Right. Pull out my smartphone.
So you just scan this QR code here and see that little box that popped up? So just click on that. Okay. And then see how it says the stars and type something. So if you don't mind just filling that out for me. Sure. I guess I can use my voice transcriber.
Such great experience, period. Love these guys, period. They are my new dentist for life for as long as I'm in this town. That's it.
Awesome, thank you. And now, in that less than a minute, you also just got entered to win free prizes. So there you go.
Oh, that's cool.
Good day, right?
Yeah, good day. Awesome. So that's the routine.
Everyone tweaks it a little bit, but it's whatever's comfortable.
Yeah, good. So you guys drill that scenario, and then are you targeting and giving people targets and quotas for reviews, or do you guys watch the targets and quotas for the week?
We set a quota for the week. Usually we try and do at least 20 reviews, but if we have like a big goal that we're like right near, then we like really push them, and our team will kind of go out of the way. They really like a sense of competition. So if we make it a competition, it's even better.
Love it.
But we give them all a target, so 20 reviews a week, and then they all have individual goals. So you get 3 reviews, you get a prize. So you want to be the one that wins the prize. Awesome. And we have like a big thermometer too that we keep track on, color it in.
Anything else that maybe another practice could benefit by you and Beth and your awesome experience and having overcome barriers to when it gets sticky or reviews don't start, they stop rolling in?
I mean, when we notice that reviews stop rolling in, we just check in with the team, see what's going on. Drilling things is essential. It really gets everyone comfortable. It's not something that everyone likes to do initially when they first start here, is asking for feedback about themselves. That's something that takes a lot to confront. So it's something that we have to get them comfortable with. So just making sure that you're repetitively drilling it and working with the team is super important.
Awesome. Well, thanks. Those are great tips.